Chronic Illness and Mental Health, Part 3, Diagnostic Problems, Invalidation. Misdiagnosis or no diagnosis. Autoimmune and other disorders that may present with a vague or a diffuse cluster of symptoms or are difficult to diagnose seem to be at an all-time high. The American Autoimmune-Related Diseases Association estimates that approximately 50 million Americans live with an autoimmune disorder. On the other hand, the National Institutes of Health, also a reliable source of information, claims that only 23.5 million Americans suffer from an autoimmune disorder. The NIH recognizes less than half of what is reported by the AARDA. Why the discrepancy? Well, NIH-funded studies include only 24 diseases and disorders, while recent studies by the AARDA now include upwards of 80 to 100 diseases and disorders. Research is ever evolving, and it is hard to keep up. You can see why chronic illness may be a confusing subject for so many people when two reputable organizations who lead our understanding of what diseases exist supply different numbers based on what they consider to be different facts. Currently, conventional Western medicine does not seem to know how to detect or diagnose many of these diseases accurately. You may have personally been to doctor after doctor, hoping to figure out what is wrong and receive a treatment recommendation. When you are not able to be properly diagnosed or treated, it becomes an invalidating experience. You know that your body is physically off, but a doctor looks at your blood tests only to tell you everything looks fine, or is puzzled by inconclusive or confusing results. Perhaps your healthcare professional is able to make a diagnosis, but then unsure what treatment to provide. Maybe the doctor recommends a medication to hopefully relieve some symptoms, but this often means coping with side effects, and you both know this is not solving the problem. When you do not understand why the problem is happening in the first place, the entire process of trying to get back to your normal, healthy functioning is frustrating. People have a range of experiences with attempting to receive a diagnosis, including being told they are exaggerating their symptoms, giving a proverbial pat on the head and told to deal with it, being prescribed medications whose side effects make it difficult to impossible to function, or well-meaning doctors shrugging and looking puzzled because they do not know how to help. Invalidation. Adding this lack of understanding to the stress and exhaustion of having an undiagnosed and or chronic disease can feel invalidating. This adds additional stress and worry, maybe even worsening how sick you are feeling. Well-intentioned family and loved ones may also contribute to this feeling of being misunderstood. Have you ever had a cold or flu or some minor ailment and posted about it on social media? If so, you have probably gotten treatment recommendations from people with whom you didn't even know you were friends. Soak your feet in honey. Use essential oils, they cure cancer. Stop eating red cabbage, and other offbeat suggestions are almost guaranteed. Often, someone will swear that their best friend's aunt's ex next-door neighbor or someone equally as elusive swears by the cure they are presenting to you. People typically don't mean any harm. They want to be helpful and for there to be an easy cure for what ails you. Even so, this can leave you feeling worse than before you reached out for solidarity. What happens is that this advice giving oversimplifies the chronic problems you are faced with and can make you feel unseen and misunderstood. The suggestions imply that if you just took this one simple action, you would be fine once again. These feelings of frustration, loneliness, and misunderstanding can also happen in conversations with loved ones. People in your life may not understand your particular limitations or be sensitive to them. Often, when people are in pain, for example, their cognitive abilities and emotional control centers are compromised. Try solving a complicated math problem in the midst of a splitting headache. Even if you can accomplish this task, it is much harder to do than when you feel well and takes putting forth a lot more energy, leaving you feeling depleted afterward. People in pain or coping with other chronic symptoms may not know or be able to communicate all the ways they are affected. It can take a while to learn that you have brain fog, that your memory is not what it used to be, or that regular physical activities now cause pain and you are unable to finish. Loved ones may be frustrated that you are not trying hard enough, when in reality you can't think as fast or recall facts you used to be able to, and you also cannot communicate that this problem exists. If you are struggling with invalidation as the result of the diagnosis or treatment of a chronic illness, or loved ones' reactions to your experiences, listen on for coping strategies. Self-validation. A first and essential step to coping with the unpredictability, chronicity, and difficulty with diagnosis and treatment is validation. Everyone needs to be validated on a regular basis. Validation does not mean that you need to be complimented or pacified. Rather, validation means feeling like you matter and knowing that you make sense. This is a basic human need. If you are living with chronic illness, you may feel invalidated by the medical community, family, friends, or even yourself. When doctors throw up their hands and don't know how to help sufficiently, or friends and family have trouble understanding what you are feeling and need, it is easy to feel demoralized and start questioning yourself. Am I exaggerating this? Is it really that bad? Is there something wrong with me that I can't cope as well as others? You may have read in my previous installments or even personally experienced how the unpredictability and chronicity of a disease increases the difficulty of being able to cope. When you add chronic invalidation, go through each day feeling misunderstood, and then even perhaps blame yourself, this adds to the stress your body is feeling, making you feel worse emotionally and physically. If you see yourself in this description, it may be time to learn and practice the art of self-validation. Self-validation means learning the skill of saying to yourself, I make sense. What I am experiencing matters, and I make sense. This can be difficult when you are not sure what you are feeling, what the reason is you're feeling this way, or know why you are experiencing what you are.